right. The left ventricle contracts, opens the aortic valve, and blood moves into the aorta. The part that's moving upward is called the
Aortic arch.
ascending
Oh,
aorta.
ascending.
And then here it arches and it becomes the aortic arch. Good. And then it descends and goes down. And that's all the descending aorta. These branches that come off of the aortic arch have names. This is the brachiocephalic artery. This is the left carotid artery, common carotid. And this one is the left subclavian.
Makes sense. Those are great words. So
The left subclavian travels underneath the clavicle. Then it goes to the axillary region, and it's called axillary. It goes to the brachial region, it's called brachial. It then goes down to the ulnar and the radial regions, and hence their names, radial and ulnar
Where is that
arteries.
again?
On one of those little arm models over there.
No, the vein that you're talking about right now.
The arteries, this one coming up. See, so this is this one here. It's the left subclavian, and it comes up and goes around underneath the clavicle and then into the axillary region, in which case now it's called axillary. So they're named based on their regions.
Okay.
So this would be subclavian. This one in the middle here is left carotid. This one over here started out as the brachiocephalic. It then branches in humans into the right common carotid and the right subclavian.
I'm gonna label the whole.
Coming down, the descending thoracic aorta has branches that go to the vertebra and to the lungs, but you're not seeing it in this model. It then passes through the diaphragm, right? Here's the domed muscle of the diaphragm. And it breaks through the diaphragm here, and now it's called the abdominal aorta, or the descending abdominal aorta. There are 5 branches that we want to be familiar with. The first one is called the celiac trunk. The celiac trunk has 3 main branches. One branch shoots this way to the spleen, so it's called the splenic artery. One branch shoots over here to the liver, so it's called the hepatic artery. And one goes to the stomach, and it's called left gastric artery. The second branch here is called the superior mesenteric artery. The superior mesenteric artery supplies most of the small intestines. Then you have these 2 branches going to the kidneys, so we're going to call those right and left renals. Then we ascend down here, and we have these 2 little guys that come off, and those are the right and left gonadal arteries, so they're going to go down to the reproductive organs. And then the last branch off of the abdominal aorta is called the inferior mesenteric artery. It supplies most of the large intestine blood. Down we go, and then we see it splits. The first split is called the common iliac. There's a right and a left, so you should be able to identify rights versus lefts for next week's quiz. Then that again branches. One part goes external, and one part goes internal for all the pelvic organs. This is external iliac, internal iliac. The external iliac goes through, penetrates the inguinal canal,
Sorry.
and becomes the femoral artery. And then we walk through the femoral artery, popliteal artery, tibial artery, fibular artery, all those that were down into the lower extremity. Yeah.
Is that it?